So how does cataract surgery work? Cataract surgery works by essentially removing the cloudy lens, which is causing blurring, and replacing it with an intraocular lens. Once the diagnosis is made and the discussion is made with regards to what the next step should be, if the decision is to proceed with surgery, you would need to undergo a number of tests to determine certain aspects of your eye. We need to know the length of your eyeball, the shape of your eyeball, your refraction, and that will let us determine what implant would be best for you. And then you'll be counseled regarding the surgery, and then we'll embark on the surgery. Now, typically you'll be in hospital for about 2 hours, maybe a little more than that sometimes. The first hour would be for the nurses to put drops in your eyes. For the surgery, we need to have you very well dilated. In other words, get the pupil to be very wide open so that the surgeon can see the lens very well. It makes the surgery easier if there's a bigger and clearer operating field. So the nurses will do that. You'll be in the surgery proper for about half an hour all told. That includes preparing you on the table and getting the microscope across and cleaning the eye and everything. The actual surgery takes about 10 to 15 minutes, typically. So once the surgery is done, we will send you to the recovery room where you'll be there for about another 15 minutes or so, and then you'll be ready to go home. So at surgery, what we actually do, after we've anesthetized the eye, we place a speculum in the eye, which is a special instrument which keeps the lids apart so that even if you try to blink, you wouldn't blink. Some patients ask what will happen if they blink, but this doesn't happen because the lids are securely open. And then we would use a special instrument, we call it a phacoemulsification machine, to remove the cloudy lens after carefully separating the capsule from the lens itself. And then we would get all the cloudy lens out and then replace it with an implant. Now, there are different forms of implants, and we discuss this choice of implant before surgery with the patient. Some patients opt for correcting the vision with just single vision glasses for distance. So they have single vision glasses and they wear glasses for reading. Some patients opt for what we call monovision, in which we create a slight disparity between the two eyes, giving one eye an advantage for far and the other an advantage for near. And through neuroadaptation, the brain is able to use both eyes properly for all distances. And then the other choice would be multifocal lenses, at the other bifocals or trifocals, in which the lens we place in the eye has the ability for patients to see all distances. These intraocular lenses have improved quite a bit over the years, and their side effects, which include glare and halos and loss of contrast sensitivity, have been minimized quite significantly. And by and large, patients are extremely happy with the trifocals and bifocals, so long as the right decision has been made prior to surgery.